you have to look at things in an overall kind of thing, not just one complication versus another. And I want people know that spine is not a rare disease that only a handful of people have. Spine is not it's a public health issue. Spine is right now number 2 reason for disability in the United States, and the rest of the world wasn't among top 10 in 1990s, and in 2015 was number 4. Amanda, actually, we just looked up not long ago the number of the spinal fusions are performing in the United States. Amanda, what number did you find when you researched that?
1.6 million in the United States. But then I always want to say, like, that's just how many people did get the surgery, not how many people needed the surgery.
Right.
And so this, you and I are talking right now about the public health issue that may break our medical system if we don't have a better solution. Yes, we do this and that, but now the current system can just not continue that we put the patient a week in the hospital.
Right, for 4 days in the hospital with a complication rate. Yeah, sure.
Yeah.
And then, add to that when you start looking at what's the cost of that versus what's the metric that the public health and politicians measure, we're not measured. We don't do anything that shows up on those metrics. We don't lower blood pressure. We don't increase life expectancy. We don't, we don't decrease child mortality. We don't decrease, spontaneous miscarriages, et cetera. Mm-hmm. Those are the things that public health people focus on. We spend a lot of money making people's day better.
Yeah.
And,
lots of people's.
And dramatically better. And I'll give you probably the biggest thing I can say about that is I've had surgery. As I joke one time, I'm not just the president, I'm a patient of the Hair Club for Men. I was conservative on taking people to the operating room until I had my disc herniation in my neck. And that was indescribably awful 6 weeks. And when I woke up from my surgery and it was better, mm-hmm. It changed the way I practice medicine. I realized how devastating that pain is to people. It's very easy to minimize somebody else's pain because everybody has back pain. That's human nature. Everybody has back pain. And so when somebody has a real problem, we tend to measure it against, well, I've had that before. That wasn't so bad. Nerve pain's a whole different animal. It is a different animal.
By the time you're 70 years old, there's only 1 to 2% chance you don't have spine problem. Thanks God, we don't have surgery on all of them. But for many of our colleagues, and that's the fact, and I really appreciate that what you said. Once you went through the same thing, your perspective changed. I have back pain myself, where I cannot move an inch, and it happened to me every year once, maybe every 2 years once, that I cannot move an inch. Yep. So I know what back pain is, and telling to a patient like that, you just have to go and live with it because your surgery is not safe in my practice. And we tell that to lots of obese patients, to lots of elderly patients, that, you have to live with it. Yes, you have a problem, but surgery is way too risky. By the way, I don't want to go and learn new things.
Exactly.
Reduce the risks.
I don't want to do what makes me uncomfortable to get you from to help you not be uncomfortable.
Yes.
The crazy thing about, MIS in general, minimally invasive spinal surgery techniques in general, but specifically the OLIF, is I don't really care how obese the patient is. Mm-hmm. As long as I can x-ray them, it's fine. Or how old they are, because my anesthesia time is going to be an hour at the most, and my blood loss is going to be 0. And in fact, we went through a phase where we were doing them with conscious sedation and local anesthetic. And that's doable. It's tricky, but it's doable.